Welcome back to KXAN News Today. It is 8:24 on this Saturday. Hope your weekend is off to a nice start, and hopefully you have some fun weekend plans. But I might have a little bit of advice for the women out there watching, or maybe the men. Remind the women in your life that October is Breast Cancer Awareness Month, and today we're joined by Kimmie Ellison. Kimmie is the Director of Clinical Operations at the Breast Program Center at Ascension Seton Medical Center, Austin. Kimmie, first of all, thank you so much for joining us and getting up early on your Saturday.
Thank you. I would get up any hour of the day for this.
Yeah, it's important, an important conversation that we're going to have. So I understand you were diagnosed with stage 0 breast cancer in 2020.
Yes.
A tough year for sure for everyone. But can you talk about your journey and how you caught it so early?
My journey was a little unusual. So I was diagnosed with a stage 0 breast cancer in my left breast. This was caught incidentally because I had access to healthcare, I had access to screening. A benign appearing mass was found on the right breast, for which the radiologist recommended I have 6-month follow-up. I went back for a special screening exam. This was a contrast enhanced mammogram, which demonstrated a new finding in my left breast. The radiologist said, you need a biopsy. I went back the next week for a biopsy, and then I received a phone call a couple days later saying there is some ductal carcinoma in situ on the pathology.
Wow.
Yeah.
Well, I mean, you were definitely proactive about that.
Yes.
Let's talk a little bit about the age. I think that's really important for sure. When should women be getting exams or even be thinking about breast cancer, the risk there?
This is such an important question. I'm so happy you asked. So, women of average risk need to start annual mammography when they are 40 years old. That doesn't mean we want you to wait until you're 40 to start thinking about this. Every woman needs to start having that conversation with her healthcare provider, probably in her 20s. She needs to be aware of her family history. She needs to know who had breast cancer at what age in her family. Average risk women start at 40, but some women may start earlier, even in their 20s, depending on their personal history.
Yeah, I know women in their 20s who have had breast cancer, so it is a tricky question when it comes to age.
For sure.
So what comes to mind? A mammogram or maybe a breast ultrasound, but what about when it comes to early detection, how do at-home self-exams come into play?
That's an excellent question. So it used to be do a breast exam every single month, and the data on that is not clear. Now it's not necessarily recommended that we do a breast exam every month. Different providers recommend different things. We definitely want women to be aware of their breasts, and if they notice any changes, don't wait for your annual screening mammography. Call your provider, get an appointment, talk to your physician or your nurse practitioner or the physician's assistant about whether or not an ultrasound or interval imaging is appropriate in your specific situation.
That's good to know.
Do not wait.
There's a hashtag of feel it on the first.
Yes.
And so I think about that on the first of the month. Now, I know we've come a long way in breast cancer detection, awareness, but the numbers show is it 1 in 10 women, or
it is 1 in 8
or 1
women.
in 8?
1 in 8 women. I tell all of my patients there is no one who is low risk for breast cancer. You are average risk, which is about 13% of women, or you are high risk, depending on very personalized risk factors.
Wow, 1 in 8 women are still diagnosed with breast cancer, huh?
Yes, but the great news is that if we can catch it early before even a physician can notice it on exam or a patient can notice it in their breast, if we can catch it on screening, the rates of cure are literally almost 100%.
Wow, okay. Well, an important conversation. We could keep chatting all morning.
Oh, I could talk forever.
I know personally I'm due for another mammogram, so got to get those scheduled for sure. Well, thank you so much, Kimmie, for joining us.
Thank you for having me.
I know. Well, and if you need any more information, you go to KXAN.com, but we will be right back. Keep it